Hi everybody, welcome to Newsdesk. Thanks for joining us this week. I just want to share with you our UHN Care Model project, and some of you may have heard about this, and certainly quite a number of you have been engaged, and I feel it's time that we really need to begin a series of discussions about what has transpired and where we might be going. So just to back up, I want to say that our CEO, Dr. Bob Bell, commissioned a review of the model of care at UHN and asked Corpus Sanchez International, that's CSI, to come and help us with some benchmarking and look at how we compared unit by unit with other like organizations across Canada, academic health science centers preferably, and also some larger community organizations were included in that comparison. And that benchmarking report was brought back to us by CSI from the external comparators, and at the same time Allied Health have initiated a benchmarking process which is still underway, and we are awaiting the results of that to see how do we compare in terms of our Allied Health resources across our programs to other like organizations across Canada. And thirdly, a large-scale internal care review was led by our corporate nursing team under Dr. Deborah Borns and with the assistance of Dr. Claire Millette. And so Deb's team in New Knowledge and Innovation did a great deal of the data collection and analysis. Claire was involved in supporting the teams who were collecting data, and Patrina McGrath, Director of Nursing at the Toronto General, led for the site directors, and they, together with their managers and staff at each of the sites, were actually led and gathered the data for a patient care needs assessment across the board, as well as an environmental complexity assessment. And then bringing all of that data together, hearing from practicing nurses across all of these units, inpatient units, about the care that their patients required, and reviewing charts as well, and making an assessment of the complexity of that unit environment, and doing so over 2 points in time using a reliable and valid tool. These teams gathered from practicing nurses and the managers and educators at the unit, as well as external reviewers who came to assure a consistent process across units. That data was gathered and brought together with Dr. Deborah Bourne's team to look at and analyze and combine with our Nurses for Tomorrow data, our HR data, to produce unit profiles. These unit profiles talk about the complexity of care needs of our patients and the complexity of the environment. And from that data, as well as the data that has come from the benchmarking process and will come from the Allied Health benchmarking process, will provide us with a data set, a very, very strong data set that will help us to know how best we should structure our model of care and how best we should provide an infrastructure of leadership support for practicing nurses within the care delivery environment. And so the findings and recommendations are still being worked through at this point, but I can tell you that we established a tremendous group of principles in agreement with the clinical vice presidents. And the first principle is to maintain a solid foundation of patient care as a platform for a strong academic, innovative, and research-driven center. And the knowledge and expertise of our staff and the teams across all of the units and the clinical expertise there is critical to our care delivery today and to our academic agenda today and tomorrow. And so the knowledge and clinical expertise there supports both quality and patient safety. We also set a principle that leadership infrastructure at the point of care should enable full capacity and full scope of every interprofessional team member, and that the fundamental leadership infrastructure includes certainly a nurse manager and an advanced practice educator, as key professional leaders and others as needed based on the complexity of the care delivered in that unit. And that flexibility and elasticity need to be built in to meet patient and system needs, so that as the numbers of patients increase or decrease, we need to be able to have some level of flexibility, and that we want to assure that there's internal equity and consistency within the context of the patient and environmental complexity. So we have established those principles, and we are being guided by those principles, and most of all, we are being guided by the feedback of our staff and the teams at each unit to determine what the recommendations will be about the model of care. And as those recommendations unfold, I will bring you further reports. That's it for today. Talk to you later. Bye-bye.